Hello everyone, welcome to Unacademy special classes. And this session is in regards to in-depth analysis of editorials and articles, which will be very useful for your prelims as well as mains examination 2020. And about me, I'm Sandeep Bhushan. I have 8 years of teaching experience for civil services. I teach international relations, internal security, and in-depth analysis of editorials and articles along with the contemporary issues. And this video is in regards to how to crack prelims 2020 and mains 2020, emphasizing on the trending topic which will be useful for factual and analytical point of view from prelims as well as mains point of view. But prior to getting into the topic, there is a notification about Let's Crack UPSC CSE English, which is India's largest learning platform. Upon subscription, you would have access unlimited and recorded courses from India's best educators, and you will have all the privileges, that is in regards to the daily live classes. You will have live tests and quizzes, you have the structured course, and also you have the unlimited access in of all the courses. And these are all the top educators. You have it on your screen at Unacademy. Along with that, you have all the top educators which you can see it on the screen. And these are the courses at Let's Crack UPSC CS English. That is, you have polity, geography, current affairs, and various others courses which you can see it on your screen. Along with that, you have the other courses which you can also see it on your screen. That is for UPSC CSE English, essay writing, internal security, CSAT, and also along with that you have the interview preparation. So these are all the courses in the Let's Crack UPSC CSE English. And in regards to notification, you have 12 months notification and 24 months notification. So it's always better to go ahead with 12 months 24 months notification for UPSC CSE subscription. And while going into this subscription, please go ahead with using my code SVT10, wherein you will get 10% discount on the original price, that is 48,000, and the discounted amount would be 43,200. So it's always recommended that you go ahead with the 24 months preparation, which is very useful for the civil services examination. So please go ahead with 24 month subscription, because you are paying only for 13 months, but you would be getting the subscription for the 24 months. And now I'll get into the topic, that is in regards to the in-depth analysis of the editorials and articles of the Indian newspaper. But prior to getting into uh, the topic, I would say a very big hi to everyone who are waiting. A very big hi. Bhuban, Kumar, Anirudh, Sushant, Mule, Alok, Jahnavi, Anshu, Harpit. A very big hi to everyone. And then today we'll go ahead with the topic which probably you might be not really having a very good knowledge, or not really having a insight into that particular topic. I will go ahead with that. And this is what it is. Leeleshwar Atun also, very good morning. Hi to everyone. And this is what it is. Can you guess what the topic would be? And this is what the topic is. And it is a very important topic, which probably many of the civil servant aspirant might not still focus on it. I'm saying very confidently, I'm saying probably many of the civil servant aspirant might not have focused on this, but we will focus on this today. At when in-depth analysis we will focus. And can you guess what is the topic? What could be the topic today? And the person who is here on the screen is the Health Minister Harshvardhan. Arpit, Sushant, Kumar, Uban, Anshupriya, Mule, Alok, Harpit. Can you please guess what could be the topic looking at this? Yeah, Ashish Kumar, very good morning to you. Lockdown breaks the chain of spreading coronavirus. Okay. Mule Alok says lockdown breaks. See, I'll take just 15 seconds. I will definitely give some time here, 15 to 20 seconds. The reason is because it's a kind of what is a brainstorming. Before we get into the topic, when you try to what you think about it, then the essence of the topic, or else the entire explanation, or the time you are spending also will be valuable time. So that is why I'm taking up this one. Your might in the end shows your seriousness about UPSC. Okay, fine. Thank you very much. No, I want the civil servant aspirant, the one you all should be very very serious, and that is my seriousness. That is also my seriousness. Can you please tell me the topic? What could be the topic today we would be discussing? Kunal Thakre, very good morning. I don't mind spending what you say 15 to 20 seconds or even 30 seconds also. I don't mind. But please, can you please tell me? And I'm telling you very seriously, probably many of the civil servant aspirants might not also focus on this. I mean, from this angle, essence of countrywide lockdown. Okay, Arpit says essence of countrywide lockdown. Okay, fine, fine, very good. Anything else you can try to infer what Harshavardhan, the minister, the Union Health Minister, is saying. Disaster management. Ashish Kumar says disaster management. Okay, very well, taken into consideration. That is what I'm saying. Probably many of the civil servant aspirants might not have focused the preparation in this fashion. What we would take up today. Okay, I will now get to the point. Anshu, Anshu Priya, please. Janavi, please. Kalpana, please go ahead with Bhuban. Please go ahead with. I have little bit of what you said brainstorming. Little bit. Nothing wrong in whatever you say. Whatever you say is right. Whatever you say, whatever you think is right, because thinking capacity has to be developed. What is important is thinking capacity. Okay, others has joined. Others, look at the screen, and then today we are discussing that. But I haven't said about what the topic we would discuss. But looking at that, can you please tell me what is the topic we would discuss today? Can you please tell me what would be the topic we would be discussing today? Okay, fine. Now I think it's time to go ahead. And this is okay. Life can be much more practical in this lockdown, and lockdown may treat us psychological. Okay, Sushant is talking about psychology. Anshupriya says this is the first priority of world to maintain social distancing. Okay, very well, very well. This is actually first vaccine. People were safe. First vaccine people were safe, and instead of this precaution is also, yes, very good. About vaccine, others says very good. And I'm happy that you all are into the depth of what you say, the topic, or else the class sessions. Very good. In fact, depth of what you say, preparing for the civil services exam. Okay, fine, very well. And now I'll get to the topic, and this is today's article. Today's Hindu article, which talks about a shot of hope with a game-changing vaccine. Okay, what type of vaccine we are talking about? Definitely, we are talking about a vaccine which is not still, what do you say, tested, but we are talking about the vaccine which is. Did you understand, everyone? Others was saying about vaccine. Okay, fine, but what vaccine? It is social vaccine. Now I'll go back to the what is the first page, what I have kept for almost a minute or so. Lockdown is a social vaccine, says Health Minister. Lockdown is a social vaccine. This is what is important for us in regards to as a civil servant aspirant. We have to focus. That is what I keep on repeatedly saying each and every time. Probably daily I will be using around 20 to 30 times keywords or key phrases. I keep on saying this. I keep on repeating this. So what is a keyword here or the key phrase here? Social vaccine. It's just a psychological treatment. That is what social treatment, social vaccine. Because still the vaccine is not available, only social distancing is the best way to keep safe. Yes, absolutely. And that is what is very important in regards to the social distancing. Yesterday I was talking about the community engagement, wherein the frontline workers, Asha workers, or many other the employees, startups, entrepreneurs, or even as part of the social corporate social responsibilities, they are getting into the people and then making them understand the importance of social distancing. I did say that social distancing, the importance of community engagement in trying to make sure that, or to educate. I was using the word repeatedly, educate. So what is the exact part of the social vaccine? Is nothing but again educating what? Social distancing, educating about preventing the spread of transmission. So that is what the social vaccine is, and that is what, look at, the health ministry has spoken about it. And when, why I'm taking this point very seriously is because when the health ministry has come up with, and then we haven't really focused on it. We haven't really focused on, but the UPSC might focus on it. UPSC might focus on what the minister says, what the secretary says, what, for example, what the prime minister says. So we need to emphasize, we need to identify the keywords and the key phrases which are really, really important for civil services prelims and also mains point of view. So there is a shot of home with a game-changing vaccine. So social vaccine is or will definitely be a game changer, because earlier people, I mean, there was a news wherein they were saying something else could be a game changer. What is that? Plasma therapy. Plasma therapy also, I mean, there was a news that plasma therapy could be a game changer. And now the new one is the social vaccine could be the game changer. Until unless the clinically tested drug comes into what do you say, availability, then social vaccine is compulsory, or social distancing is compulsory, and then social vaccine is a game changer. And that is what we need to know, what social vaccine is and how the social vaccine is. Actually, the health minister was talking about social vaccine is the best method or the best medicine at the time of pandemic situation, and how, or else whether there was any kind of social vaccine or social vaccine being implemented somewhere, or they have experienced the social vaccine somewhere else. I'm talking about it could be in India or it could be across the world somewhere. And then we will also look at what type of bacteria or virus was there then, and then what kind of social vaccine has been implemented there. We will look at the experience of the social vaccine across the world, whatever it has, I mean, wherever it has taken place, and how I mean, which virus or which bacteria is affected, and then how the people have effectively implemented the social vaccine, and then they have made sure that at least till the time of the clinically tested drug was available, they have maintained that not to spread the virus or the spread of transmission of the virus, to put a break, to put a hurdle. So that is very important. And now social distancing or social vaccine is very, very important. And I would say a very big hi to everyone before I start up. And then Sushant was also saying that social distancing can also refer to cooperation of the society. First citizen to infinite point. Yes, very well. Now we will look at who is responsible for social vaccine also. Is it the individual, or else someone else is also part of the responsibility of maintaining the social distancing and then implementing the social distancing, so that the social distancing would be a game changer, not to making sure that the infection of the virus is not spreading virulent. So look at it here. Here you can see very clearly there is social distancing maintained, and then there is one individual who is going ahead with, what do you say, helping hand. It's a helping hand, but when the helping hand is being or he is in picture, people are not thronging together. They are not in a group. They are maintained at the equal distance. So this is what is important. This is a nut of what we are actually discussing. You do anything, you help, I mean, as an individual, as a group, as a corporate, you help, yes, definitely. But while you are helping, making sure that social distancing is taken into consideration. So when you are taking into consideration social distancing, or you are part of maintaining the social distancing, or when you are part of maintaining the stricter measure of physical distancing or social distancing, that means you are also creating, or you are part of the social vaccine. You are also part of social vaccine. That means your contribution towards the social vaccine before the clinically tested drug comes into action. So now we will get into the topic. So as we know that the topic, what the heading I have taken it as social vaccine. Social vaccine. And then we have seen the first lockdown was till, what do you say, almost it was till last week, March 24th till last week, and then again the Prime Minister has extended it further till May 3rd. And this is very clear that the extension till May 3rd is the necessity, is the need of the hour. It is imperative for the government to make sure that still there has to be a social distancing. Still, because of the vaccine not being available, clinically tested drug or vaccine not available. The point is that okay, today's topic seems psychological, isn't it? Okay, fine. We can take it as psychological also, or psychology also, part of which could be again what do you say? And I'm making it very clear. This could be part of essay, general essay. This could be part of general essay also. Fine. And what we have seen, the importance of this social distancing or else extending the national lockdown. Extending the national lockdown is because we have experience, we in the sense the health ministry and then the ICMR has experienced, the health ministry and the ICMR has experienced when they have gone ahead with the testing, that while they are going ahead with the testing, the asymptomatic cases are very high. The asymptomatic cases are very high. That means whenever the transmission is happening, the failure of, I mean, definitely we are not going ahead with the aggressive testing. Definitely aggressive testing hasn't still effectively started. Yes, ICMR is saying that we will go ahead with that aggressive testing, and probably in the second lockdown now the aggressive testing might go ahead. In the second lockdown, second phase of the national lockdown, the aggressive testing from now onwards till, I mean, from the time the second lockdown till May 3rd, there could be aggressive testing by the HM and then ICMR, that is health ministry and then the Indian Council of Medical Research. So thereby what is happening is we are making sure that the testing will take place for the infection or for the immunity. It could be for the infection not to take place, or else making sure that how the immunity can be actually can be increased, to make sure that to spread or to break the transmission of the COVID-19. Why? Because there is a concept, I mean a problem which is actually a problem to the doctors or to the ICMR or to the health ministry. That is, we are going ahead with many kind of asymptomatic cases. Asymptomatic, what do you mean by asymptomatic? That means the one who is infected, as I said earlier also, the one who is infected but not showing any symptoms, but not showing any symptoms, infected but not showing any symptoms. So that is the what is the cause of concern, and that will have, I mean, that we can detect only when we go ahead with, we can detect the asymptomatic cases also only when we go ahead with the testing, only when we go ahead with the testing, and then and then only we can make sure that the person is infected. Only then we can say that the person is infected. Until unless testing goes ahead, the person seems to be healthy but he is carrying the virus, he or she is carrying the virus, he or she is a reservoir of the virus. I mean, it develops because the incubation period is somewhere around 12 to 14 days. So by this the person would be also an reservoir. So in the process, what is important is we need to make sure that testing is the most important thing. Testing has to be done. Otherwise, the asymptomatic person will keep on spreading the virus very violent without his or her knowledge. So the problem is not that person. But what is important to even go ahead with before the testing, what is important is social distancing. And we have gone ahead with the social distancing with the first national lockdown, and now we are going ahead with the second national lockdown. And in the second national lockdown, what the government is planning is the aggressive testing. And aggressive testing is because there are many asymptomatic cases, mildly symptomatic cases, and pre-symptomatic people are undetected. What is important is this is important, they are undetected, and that is a cause of concern. That is a cause of concern that we are actually talking about the social vaccine. Why we are talking about the social vaccine is because the infected people are undetected. Why they are undetected? Because they are asymptomatic or they are mildly symptomatic or they are pre-symptomatic people, and they are undetected because we are not going ahead with the aggressive testing. And in the second lockdown, definitely the aggressive testing will go ahead, and then making sure that we will contain the virus. But prior to that, what we were talking about or what the heading is, that is the social vaccine is very important. As you all have mentioned, social distancing. And before I move further to the next point, Anshu Priya said they also announces door-to-door testing. Yes, if the situation is not settled, yes, definitely they would go ahead with aggressive. That is what the aggressive testing is. That is what aggressive testing is. And the one who have joined, everyone who have joined, I would say a very big hi to them. And the Harpreet also has come up with a point saying that people have to understand the practicability of the maintaining social distancing as we can at most places. People coming out for collection rations or other essential commodities, they do not maintain social distancing, but while coming or going back home, they again stick to each other, ultimately defeating the purpose of social distancing. They need to understand that they can be anyone be the reservoir of, of this virus. Yes, absolutely right. Absolutely right. And based on this, based on your point, Arpit, based on your point, or else the one who are all thinking in these lines, on these lines also, the one who are all thinking, who have the, what do you say, exact understanding, but haven't put forward. That is why UPSC will focus. The one who, I mean, the purpose of the social distancing is not met because of XY reasons. It is not met, but it can be taken into consideration by different means. What are the different means? Many of us will not concentrate. UPSC will concentrate. UPSC will focus. We will not focus on. What is the other alternative? The best alternative is a social vaccine. That is what is important. And the dire socio-economic consequences. And what we were talking about yesterday, that when the social engagement, that the ASHA workers or the frontline workers, they have been to the communities and then to the various societies or the slum areas to make them educate what is the importance of the national lockdown and what is the importance of the social distancing. I have also repeatedly said that they are not worried about the social distancing. They are worried about their job. They are worried about the essential commodity, that is a food grain, that is a ration, and that is making them annoyed. That is making them a kind of, what you say, situation that they do not wanted to accept the national lockdown. Why? Because the socio-economic consequences. Why they are unable to accept the national lockdown? Because of the socio-economic consequence. And this is a keyword what you need to understand here. Because of the socio-economic consequences and the amount of, what is a tragedy they are facing. What kind of tragedy? Because they do not have the jobs, they do not have the salaries, they do not have the income, they do not have the savings. That is what the human tragedy they are facing, and that they are facing because of the prolonged national lockdown. And because of this, there is lot of, what you say, agony, a tragedy within the people. Many of them, what do you say, almost 60% of the Indian populations are really worried about the extended national lockdown. And Sushant says that US rapid testing versus India's testing. US tested more than 7 lakhs, India just at, yes, definitely. But what is the point is, okay, I'll tell you what is the point is not mm, making sure that India was worried about lives, US was worried about livelihood or the economy. That is only difference. That is the only difference. 7 lakhs, and then here 20. I mean, but you have, it is also good that you would also mention, Srishant. It's just a, what you say, sense of humor. It is also better that you would also mention the number of death cases and the infected cases. Okay, there could be. I mean, there are critics that underrating or underreporting of the what is the number of cases, infected cases and death cases. But we will not really look into it. But the other side of it, it's just a sense of humor, Sushant. And then hi to everyone. Hi to everyone. Because India is a country wherein it looks at the lives, but when you look at US, Trump is focusing on the economy. Probably it is one more reason that he would go for elections. I mean, America would go for elections. America would go for elections in the month of November 2020. Probably he wanted to focus on the economy. That he has promised to the Americans that a stable economy would be, or else the more of jobs created to the American youth. Probably that because of that. Fine. And along with the infection control, what we have this infection control, a strategic plan of action has to be to stimulate the economic recovery. As we were all talking that yes, lives and livelihood both are important at this moment, and that is why social distancing is taken into consideration. Second lockdown has also come into point, but definitely there is a strategic exit plan. There is definitely strategic exit plan where the government has come up, and then slowly it is making sure that the economic activity is into progress, so that the economy would come a little bit stability. And then now we will talk about the exact what the picture I was when the image what I was talking about, what I put, that is the Union Health Minister Mr. Harshvardhan has said that or asserted lockdowns and social distancing are the most effective social sciences. So you all are right, you are all were talking about social distancing or the vaccine. So you are all right that as Minister Harshvardhan has spoken about, has asserted, as emphasized on the social distancing is the most effective tool, or it is the most effective social vaccine before the actual clinically tested drug or the vaccine comes into availability. Social vaccine is very important. And now we will look at what is social vaccine. and this could be your prelims questions in saying that which among the following is a social vaccine. So you will be totally, what do you say, you should not be totally blank or dark there, because you only know about pandemic, you only know about clinically tested drug or the vaccine, but what is, or else you knew about BCG vaccine there, I mean many of them, or else you know about the hydroxychloroquine vaccine, but here it is talking about social vaccine. You should not get confused. You have the information now by this lecture. And Shushan, don't you think in India cases are more than shown by government only because infrastructure for testing it should be supersonic test, not just rapid or making statement? Definitely, definitely. We all know that what is the condition of the health infrastructure of India, comparing it to the US or else any other country, or else any other country. As I was talking, as I made this point n number of times, only 1% of our GDP is to the health. So, taking into consideration the 1.3 billion population, and then the density of the population, and then the amount of, what do you say, the slum dwellers. If you look at, definitely testing, and we do not have, what do you say, many testing kits also, diagnostic testing kits, and the ventilators we are talking about. So on the whole health infrastructure, definitely what is the only method what is left out with us is at this moment social distancing. And I made a point, n number of times, the government or the prime minister was going ahead with the national lockdown, that is social distancing, that he was just bargaining time. I have used this word n number of times. He was bargaining time. Why he was bargaining time? So that in the meanwhile, could be 2 or 3 weeks or 3+ weeks, he would get these, what you said, testing kits, or the laboratories for the testing would be high, or else we can go ahead with more of ventilators importing from various countries, or else in regards to the mask, or in regards to the, what is a PPE, personal protective equipment. And these are all, what you say, it was not present at that moment when it was all of a sudden the pandemic. And that is why I personally feel the prime minister was bargaining time in going ahead with the national lockdown first time, and also for the second time, so that social distancing is taken care, not to go ahead with infecting or the spread of virus, or to break the transmission of the virus. Meanwhile, the diagnostic testing kits from various countries, and then mask, and then, what do you say, this ventilators would definitely, what do you say, we would go ahead with importing them. Between this time we wanted the social distancing or the social vaccine. That is what Ashushan says, that don't you think, okay fine, people actually get panic about this situation because crisis of economic consequences and revenues problems had to be faced. That is what, see, I've also made this point here. Yes, Anshu, you have made it very clearly. I was talking about here the socio-economic consequences and the scale of human tragedy that play out daily make a prolonged total lockdown undesirable. That is what it is, undesirable. This is not accepted by many people because it is affecting the health, it is affecting the economy. When I am talking about the economy, their livelihood, they are not worried. Those people are not really worried about the country's economy. I'm saying it very clearly, and they don't worry about it also. They're worried about only their income, that daily income, and then their livelihood, daily livelihood. That's it. And they are right in that, and why right in that? Because India also utilizes those laborers, the daily wages, migrant workers, part of the unorganized sectors, part of the informal sector. So definitely it is not, what is their mistake. It is from their point of view, it is right. So it is definitely at a different level, that is from the prime minister level, or from the health minister level, or from the ICMR, or else from the, what is a different frontline workers. It could be ASHA workers or the corporate social responsibility, that they should be in the community engagement, and then they have to make sure that they educate the people. That is the most important thing, educating people, and educating people is also part of the social vaccine. Fine. Now I'll move further. And hi to everyone who have joined. Rajneesh, Hina. Hina is also little bit, almost 29 minutes late. You are Hina. Hina, Ritika, Pavan, everyone, a very good morning to all. And today we are talking about the topic social vaccine. We are talking about the topic social vaccine. And what is social vaccine? And please do take into consideration of these points here, because this will be very useful for prelims point of view. It could be like, social vaccine, which among the following statements are incorrect in regards to social vaccine? Which among the following statements are incorrect in regards to social vaccine? So it would be a direct question, but if you are unaware of what is social vaccine, then you will not be in a position to answer it. So definitely it would be part of science and technology, science and technology. So what is social vaccine? Social vaccine addresses what it does. First, it addresses the barriers and it facilitates the behavioral change. This is very, very important. It addresses the barriers and it facilitates the behavioral change. What kind of behavioral change? It is attitudinal, it is social, it is cultural or economical. And what all you people, I mean everyone, whoever have said all the points, it is absolutely, you're right, you're true. And this is what the social vaccine talks about. It addresses, this is very important. While you are writing in the mains, please do not forget to use this word. This word is important. It addresses. Social vaccine addresses the barriers and it facilitates, or and it is a facilitator of, what is a facilitator of behavioral change, exactly in regards to attitudinal, social, cultural and economic. And not only that, it also provides information, education and communication. Yesterday we were talking about that in regards to the frontline workers, or in regards to the ASHA workers. These are the one, or else I was talking about the corporate social responsibility or the entrepreneurs. What their responsibility is to make sure that they educate the people about the pandemic situation. They educate the people about the pandemic situation, and that is what it is saying. Okay, Arpi said, sir, educating is the most vital part of the social vaccine against this pandemic. Exactly, absolutely. And then you please look at this point also. This IEC. What does IEC mean and SBCC means? You never know. This could be, both could be part of prelims questions. Part of prelims question. What is IEC? Information, education and communication. So what it does, social vaccine does is, it supplements, it gives, it provides information, education and communication about the pandemic situation, about the, what you said, the disease, about the virus, information, education and communication. So IEC is important about the social vaccine. Not only IEC, it also goes with supplementing the targeted social and behavioral change communication. It also goes ahead with social and behavioral communicational change, SBCC. So these two key phrases are very, very important while you are writing about social vaccine, or else in regards to the prelims also it is very important. So what is that social vaccine does is, it also supplements, not only in regards to addressing the barriers, facilitators for the behavioral change, but also it supplements the information, education and communication, IEC. And also in regards to targeting, I mean it focuses on the social and behavioral change communication. What is important is here a behavioral change communication, or communication which is in regards to behavioral change. And again, when we are talking about the behavioral change communication, it is social and behavioral communication, change communication. This is very, very important. And what is a social vaccine? It is a metaphor. Metaphor means it is a comparison. Metaphor means it is comparison of, for a series of social and behavioral measures. So definitely we have to go ahead with, now what is the room or space we have across the India or across the globe also, but specifically talking about India as of now. Later on we'll shift to, what you say, even in regards to the other part of the world also. Now what is that is, we need to focus on the social and behavioral measures. We do have the measures here now to contain the virus, and that the utmost is the social distancing. Utmost is social distancing. And amongst that social distancing, what is important is the social and behavioral measure. And here when we are talking about the social and behavioral measure, the prime importance is the governments. So government has to raise the public consciousness. What is important is the government has to raise the public consciousness. This is very important keyword about the unhealthy conditions or the situation, and how the social mobilization has to take into consideration. And again, a new keyword what we are talking about along with the social vaccine is social mobilization, SM. We have looked at SV, now we are looking at social mobilization. And what is social mobilization? Social mobilization can empower populations. So how does this social mobilization empower? It empowers to resist unhealthy practices. It increases the resilience. It fosters advocacy for change. So that means, see, definitely I mean, whenever there is a political meeting, they mobilize the politicians, mobilize the people to, or the large group of people to come to the meeting. to for the I mean to listen to the address of the political party leader. So they are mobilizing the same way. The same way the social mobilization should take place, but not for the political party meeting. But it has to make sure that because of the mobilizing of the people, and again here when I'm saying mobilizing, it is not in regards to what you say we are not following the social distancing. No, mobilize is making sure that the people understand the intricacies of the spread of the virus. How to make sure that they resist on unhealthy, I mean they should move away from the unhealthy practices. They should increase their resilience in the sense that kind of approach they have towards the handling the situation. And then they should also foster the advocacy. That means what kind of changes have to be actually put into practice to counter the COVID-19 is very important. Okay, before I move to the next line, Sushant has written something. I will just read that. Little beyond our topic, what if this pandemic came during Kumbh Fair Act Prayag, where people used to take heavy holy bath, and for the practice, people came from all over the world, and this community transmission would take a month to hit India's 5 to 10% of the population. This type of question asked in UPSC means what if there is no Gandhi? Okay, this type of question asked in UPSC. Okay, okay. Doctors also protest for mask and kids equipment because of the unavailability of the equipments. That is what I was saying. It was my personal view that probably the Prime Minister of the India is going ahead with bargaining more of time to get all those personal protective equipments, masks, ventilators, and then diagnostic kits by extending the national lockdown. And everyone who have joined, I would say big hi to you. And what Sushant said and then what Anshu has said is absolutely right. Now I'll move to the next point or the next slide. So social mobilization, now we will look at what is social mobilization. So it is a political will. As I was giving an example that when the when a political, okay, Ram Kumar has also joined. I would say hi to Ram Kumar. And today we are talking about the topic in regards to the social vaccine. And the social mobilization is the most important drive which has to be taken up by the politicians, or it is a political will. And it is a political will because it is in the interest of the society. It is in the interest of the society. And then when we are talking about the social mobilization, it is the responsibility, and the government should have the accountability in making sure that social mobilization takes place. Why social mobilization? To make sure that through the social mobilization the people are being educated, or they are being given information, or they have been given communication, that is IEC, information, education, and then the communication has to be provided by the political will, that is by the government. And the government it has a duty, it is a duty bond, and also it is accountable, and it is also accountable. And then it is also making sure that all these are to make sure that there is a reduce in vulnerability of the diseases. So social mobility or the social vaccine is ultimately what, to make sure that the vulnerability of the disease, or else the infection doesn't spread very virulent. And that is the main point behind the social mobilization. And this when applied to pandemics, now we are talking about when if it is applied to the pandemics, especially in regards to, we haven't still come to the what you say SARS-CoV-2, if it is applied to pandemic social vaccine. So now we are coming to the point wherein whether this social vaccine was applied prior to SARS-CoV-2. Now we'll look at it. Yes, it was applied. I mean, it was taken into consideration, or it was applied in other pandemics, and that was an effectiveness of a social vaccine. When they have applied, it was an effective tool, that by applying the social vaccine it was very effective in trying to contain, or in trying to make sure that the spread of virus do not take place. And we have seen in the two countries, that is in Uganda and Thailand, they have used this what is a social vaccine strategies. They have used these social vaccine strategies earlier, before what we are talking about India, or else the entire world. In the previous situation also, the Uganda and Thailand have used this or implemented the social vaccine effectively strategy for HIV and AIDS. Now please get into the point now. Now we are getting some experience from HIV and AIDS, wherein people were infected when it was actually spreading. And now we are taking that experience and then putting it to the, or our making sure that that kind of strategy, social vaccine or social distancing, should be implemented effectively to make sure that we are fighting against successfully the COVID-19 or the COVID-19 pandemic. And then to bring down, why they have used, to bring down the incidence of HIV infection. So social vaccine was implemented so that the incidence of HIV infection have come down or should come down. Before any high active antiretroviral treatment was introduced in 1995. So what is important is you have a antiviral treatment, or else you call it as a high active antiretroviral treatment, that is called as HART, HAART vaccine, or HART is what introduced in the year 1995. And this is again very important for prelims point of view, because as I said that probably when we are all concentrating on SARS-CoV-2 or SARS or COVID-19, the probability of UPSC not focusing on SARS but some other virus affected, it could be HIV. So they could also pose a question on the HART. What is HART? Highly active antiretroviral treatment. Extremely sorry. So before this treatment has come into action to effectively stop the spread of infection, that is in HIV infection. So what HART is, HAART, not HART, HART. HART has come into existence, or it was introduced in 1995 to make sure that they stop the infection of which among the following, that is HIV infection. So what is HAART? It is highly active antiretroviral treatment. So what is retroviral? Now we will look at what is retroviral. Antiretroviral, yes, definitely you can understand, it is against the against retroviral is antiretroviral. So what is retroviral? Retroviral means an enzyme that copies RNA into DNA. That is very important. RNA into DNA. Even I was talking about yesterday, I don't know whether I did, I think in one of the class I did, that in regards to the SARS you have only RNA, there is no DNA, I said it fine. And that is RNA directed RNA polymerase, I said, in regards to SARS. RNA directed RNA polymerase synthesis, RNA synthesizing the RNA directed RNA polymerase itself in SARS. The same even in HIV also you have only RNA. So that is what it is, retroviral. It means an enzyme that copies RNA into DNA. So RNA directed RNA polymerase. SARS is RNA directed RNA polymerase, wherein it will also, here in this case HIV, it is going ahead with making DNA from RNA itself. It is creating DNA, making DNA, or synthesizing, to use very technical term, synthesizing DNA through RNA itself. That is retroviral. So antiretroviral, they have come up with the antiretroviral treatment. What is that antiretroviral treatment? That is high active antiretroviral treatment, HAART. I think now you have a solid one, what do you say, an answer for one question if it is asked in regards to the antiretroviral or HIV infection or HAART. And a very big hi to everyone who have joined. And that was introduced in the year 1995. And now what are the lessons what we can learn from the HIV pandemic, taking into consideration that social vaccine, implementing the social vaccine now. Fine. So we have seen this HIV, that is human immunodeficiency virus. What this virus does, this virus, it directly affects our immune system. It affects directly our immune system. It affects directly the lymphocytes. It directly affects the lymphocyte. Which lymphocyte? T4 lymphocytes. Directly affects the T4 lymphocytes. The immune system it directly attacks. Fine. So this is in regards to HIV. But when we are talking about SARS, I did talk about it directly affects the respiratory. It is a respiratory disease. It is a respiratory disease which attacks the lungs. Fine. Now we'll come back to this. And it is also believed that it is a zoonotic jump. Same like kind of what is a SARS, which is also zoonotic. SARS is also zoonotic. Zoonotic means from the animals. The virus has come to to human beings from the animal, so it is a zoonotic. And then everyone who has joined, a very big hi to everyone. We are discussing about social vaccine. So it is zoonotic, which has from first from monkeys to chimpanzees and then to the humans in Africa, and then we know just recently that it has been, what do you say, coming to the limelight. But for the first time, it has been affected, or they got to know about the HIV/AIDS. I mean, that it has been passing from the monkeys to the chimpanzees to the animals as early as 1920s itself. But it was detected only in the year 1981, and it was also, what you said, uh, made sure that by the WHO it is a pandemic. It was observed, or it was made a statement by the WHO that it is a pandemic only in the year 1985. So knowing about more about SARS, knowing about how the social vaccine can be implemented for SARS, we are going ahead with little bit information of HIV or the AIDS. Fine. So in regards to that, we have spoken about heart, HAART, fine, and then we are talking about in late 1920s itself. This spread was happening, but we could understand it only in 1981, and then only in 1981 HIV was termed as a pandemic, and then we know that this was happening, and then till the diagnostics tests have come into existence, people also, then the one who were infected, they've also maintained the social distancing, or social vaccine was taken into consideration. And this is just an, what is a statistic, it is not really important, but just to know about it. In 2018 itself, by from 1981 to 2018, just 2 years back, the number of people who were, what do you say, affected or died by the HIV across the globe is 74.9 million people worldwide, and then HIV infected 32.9 million people were died. So that means, see, look at, even now there is no biological vaccine biological vaccine for HIV or AIDS. But what, see, that is what, even now 2018 I'm talking about, I have given this, taken this statistic, even till 2018 also there are people dying because of the HIV, and then uh, in regards to the AIDS. That means biological weapon is still still not, what do you say, gone ahead for the HIV. And then this widespread contagion, and who have been infected by the HIV, they were all restricted to home, or else they were unemployed. Either they were restricted to home, or they were separated from the family, or from the group of community also. They were like kind of deported, kind of, not exactly deported, kind of, I'm saying. And there was stigma, discrimination, and violence against the individuals who were infected by the HIV or the AIDS. Not only, what you say, within the family members, but also within the it was, the discrimination has also started within the social groups. When we are talking about social groups, the HIV was virulent, or else when we are talking about the whites, it was AIDS, it was virulent, because it spreads from the sex workers, or the, what do you say, the gay men, the drug users, the one who injects the drugs, fine, and the truck drivers who are involved in the unsafe sex, and then the migrants were all involved in the unsafe sex with the health workers, all this. So that is how the virus has spread virulent. And then when it has spread virulent, in regards to HIV I'm talking about, not SARS, HIV. So there was stigma, discrimination, and violence against all these people. So when this was going ahead, now what the situation is going ahead in regards to USA, trying to say it is USA, I mean, Donald Trump initially said it is a China coronavirus. He has made this point. Trump has made this point initially, that it was a China coronavirus. That means people, I mean, the global leaders trying to blame each other. The way the US, or else even in regards to the many G20 countries, are also raising their hands or fingers against the. Shivani says, "Sir, please Hindi. I'm extremely sorry. English. It's a sense of humor. Only English I can go ahead. I'm extremely sorry, Shivani." So, because of this, as we have seen now in regards to SARS, how people are trying to blame each other. So then also in regards to the HIV and then AIDS, also there were many conspiracy theories which have come up then also, and there was much of misinformation which was passed, which was spread across the globe, that because of so and so reason HIV is been passing, so and so reason AIDS virus is spreading across many people across the world, and there were unproven remedies also which were widely propagated. And this blame game which was taking place between the world leaders and the international agencies was going on then, and also is going on now. So whenever there is pandemic situation, there is bound to happen that each and everyone try to go ahead with the blame game. Now what is a theory, blame game theory, trying to, what do you say, find fault at different countries or different, or else various international agencies. And what is important is now, because of this taking into experience of the HIV, the preparedness of health system is important. The preparedness of health system, that is what was lagging even in regards to India. We need to accept it very keenly. I mean, very absolutely, we need to accept that we were not prepared. Okay, we don't know that way when the pandemic will struck the humankind, that is to India, but our health system has to be imperfect. We have to be prepared. We have to be prepared, that is very important. And then there should not be any kind of social prejudices, and also the socio-economic inequalities which have sparked then. And now also we are seeing that socio-economic inequalities are happening, or it is growing faster, and that is why people are not going ahead with accepting the national lockdown or social, or else maintaining the social distancing, or taking the measures seriously about the physical distancing or the social distancing, because they feel all this is, or these are undesirable, because it is affecting their economic condition. It is affecting the economic condition. I'm talking about the one who are in the lower or middle income group people, or the one who are working in the unorganized, or who are working in the unorganized sectors or informal sectors. So they are unable to accept it. They say national lockdown is undesirable, but still we are talking about social vaccine. But still, please do understand how it is important. But still we are talking about social vaccine, which is part of social distancing, which is again national lockdown. And that is important now, and that is important for India, wherein India's health infrastructure is not impressive. And now we will look at misinformation. The biggest issue comes up with every pandemic, sir. Even government has put proper infrastructure to stop the misinformation. Yes, yes, definitely. As we said that they have come up with the various acts. They have invoked various acts. And now we will look at how the, I was talking about Uganda and Thailand, how the virus, that is HIV and then AIDS, have actually affected them, but they have successfully made sure that at least till the time the drug or the vaccine, little bit to some extent, it has come into existence. They have come up with the various measures in regards to making sure that how we can try to restrict the spread of HIV. So the Catholic Church in Uganda did not initially support the promoting of the, what do you say, social distancing there, or else in regards to the social vaccine. So what is important in regards to, what do you say, overcoming the HIV and then AIDS, that is safe sex is very important, or else, what do you say, going ahead with the usage of the condoms are very important in regards to HIV. So that they did not initially go ahead with it, because of the Catholic Church in Uganda felt that it is not appropriate to go ahead with accepting or going ahead with this, saying that usage of the condoms are important at that time. So they did not go ahead it, and they have, what do you say, prevented it. But once they got to know that because of unsafe sex, there were many people who were dying because of the HIV, then they have gone ahead with the usage of the one of the measure, that is social vaccine. That is measures of social vaccine they have taken into consideration. Once the lives or the deaths were higher, the mortality rate were higher, then Uganda or the Catholic Church also has come up with making sure that we have to go ahead with the measures, or in regards to the safe sex. And then in regards to Thailand also, they have come up with the social marketing of condoms for the safe sex. So immediate, that is what is important, educating, information, and then communicating, and then educating is very important, and then bringing about the social and behavioral changes are very important. See, here I was talking of the Catholic Church, or it could be any kind of religion. Forget about church, any kind of religion. Fine, when it is not going ahead with any that cultural or social cultural behavioral change, then definitely we will not be able to go ahead with the social vaccine, implement the social vaccine. Fine, but here look at later on that, what do you say, Uganda has gone ahead with making sure that they go into the their respective measures to prevent the spread of the HIV. And also Thailand has gone ahead with the social marketing of condoms for safe sex. And they have used humors, I mean the kind of advertisement or the communication or the educating, the way they have gone ahead with making kind of social taboos, that is social discriminating kind of that was in a very positive note, to making sure that how they can be away from the unsafe sex. Fine, and also they have made publicly discussing about the sex. So that is very important. So when that is again educating, educating, communicating properly, and then giving the right information is very important. So these three were done by both the Uganda and Thailand in regards to the HIV and AIDS, and that is why these strategies, when they have come up against the stigma and then discrimination, which was taken up in Uganda and Thailand, and later on we have seen also in India. India has also gone ahead with various what do you say methods, innovatives of advertisements through various what do you say the Bollywood actors or the actors. It could be various regional actors. They have gone ahead and made sure that the kind of what you say information or the educating of the people was done in regards to the safe sex. So that was the measure which was taken, that is the social vaccine which was taken into consideration, and these skills and experiences can be adapted even in current pandemic, that is in COVID-19 also. Okay, before that I will just read what Harpit has misinformation is the biggest issue. Stop this information. Community engagement can provide. Yes, Janavi says information, education, communication is also significant in context of this pandemic, taking a communal turn. Tabligh Jamaat. Okay. This has created mutual suspicion among religious communities. Yes, people need to understand that in this situation we need stand united. Yes, absolutely right, and very well said, Janavi. Very well said, Janavi. And then a very big hi to everyone who have joined now. And then now we'll link this what is a social vaccine to the pandemic, COVID-19 pandemic. And what is important is now the social distancing or the physical distancing. And along with that, what is important is that we need to maintain that social distancing can be, along with the social distancing, we have to go ahead with the mask or the facial coverage, and by that has to be 100% of people should go ahead with that. And then if they go ahead with that, only then the disinfection will what do you say stop, or else the spread of infection will not take place at a virulent. And then IEC, what I was talking about, that it is in regards to the effective and innovative IEC, that is information, education and communication is very important to be effective and innovative. These keywords are very important, effective and innovative of IEC and also SBCC. What did I say? SBCC initially itself, social and behavioral change communication. So effective and innovative IEC, that is information, education and communication, and also an effective and innovative social and behavioral change communication. That is, both are very important to be part of the social vaccine, and these two strategies are the part of the social vaccine, wherein they can address the barriers and facilitators, and they can facilitate the social change, cultural change. They can give the information, they can provide the information through the ways of educating the people. And what are the essential components of the social vaccine? That is repurposing and then funding relevant industries. So one kind of social vaccine is in regards to the IEC, and then in regards to the SBCC. Fine. So that is in regards to the, as we discussed, information, education and communication, and then social behavioral change communication. And the other one is in regards to the pumping money, funding money, that is economic activity. The other point of the social vaccine is economic activity to take place. That means they have to make sure that economic activity, livelihood is created, economic activity does take into condition, infusing capital expenditure, infusing capital expenditure is also very important. And then not only that, providing the material, that is, as we spoke about, PPE, that is in regards to the personal protective equipment, hand sanitizers, and also in regards to the cloth mask, soap, and then equipment. And these are all what you say innovative social marketing, and these are all innovative social marketing. And when we are talking about the social marketing, it is also a keyword or the key phrase which is very important for the prelims and also mains point of view. And I would say a very big hi to everyone who have joined. And then now when we are talking about social vaccine or social distancing, what is important is it really has to be practiced, and it will be practiced only when there is a will from the leaders. I did talk about the political will. I was talking about political will. It is a political will. Definitely the leaders have to promote the social vaccine or social distancing, making them publicly and consistently. That means it is a need of the leaders, it is a need of the each and every individual, but it is a need of the government, it is need of the leaders, that they should have the political will in making sure that the social distancing is taken into consideration in the true spirit, making them understand the importance, or giving them the right information, educating them and properly communicating to them that their social and then cultural behavioral changes, so that the social vaccine is what do you say, implemented practically, or it will be effective. Now, what is important is before the actual drug, social vaccine should be effective. That is the most important thing. Social vaccine has to be. Sir, थोड़ा हिंदी में भी समझा दिए. अजीम, I am extremely sorry असीम, माफ कर देना. थोड़ा थोड़ा हिंदी बात कर लिया मैं तो. असीम माफ कर देना. I'll just converse in English. Extremely sorry. And then these are all very important because it is the government or the leaders will political will makes which will make the individuals or the people understand that they are for the, or they should be for the social and then the cultural changes. And the social vaccine makes the leaders also accountable. This is very important. Again, this is very important. As in this. Okay, fine. When you are little weak in English, I am a little weak in Hindi. Probably we both can understand our own, like I mean the conversation what is happening. Am I right? Okay. So when we look at the social vaccine here, yes, the leaders are responsible. Again, look at, we are entering into a little bit what you say, the in depth of the social vaccine, wherein you can put forward in your answers in depth of the social vaccine. So who is responsible here? We are also saying that the political leaders or political will or the leaders are responsible. How the leaders are responsible? Because it is a parliamentary form of government. No doubt we are not saying that everything is dependent, or every I mean, or everything has to be taken care by the politicians or the leaders. No, it is the every citizen, every responsible citizen is also having the, or should have the will to be part of the social vaccine, or to make the social vaccine effectively. And then everyone who have joined, I would say a very big hi to them also. Now, a very big hi to them. And how they are accountable is that they should invest in what? Testing. Now I think you are getting the point. Everyone is getting the point. I think what is, how the leaders are accountable in regards to social vaccine, or not just what do you say, coming up saying that social vaccine is the best vaccine at the time of, or a social distancing is the best social vaccine. Yes, no doubt. But what is important is that even leaders should take accountability. That is in regards to the testing has to take place, and then the basic and economic needs have to be provided to the vulnerable section. Now you are getting the point. How the leaders are responsible even for the social vaccine. They have to go ahead with scaling up of testing, aggressive testing, because we all know because of the lack of testing, that is what is happening. The infection is spreading, and asymptomatic cases or mildly symptomatic cases are being more, and then these people are spreading the virus unknowingly. That is why the responsibility of the leaders in regards to the social vaccine, in fact, if it at all it has to be effective, the leaders have to be also accountable in making sure that there has to be scaling up, or else increasing the testing, meeting the basic and economic needs of the vulnerable section. That is very important. And then providing psychological support, wherein now I'll come to the point. Janvi was talking about. Yes, Janvi, you are absolutely right. And one of the social vaccine, the leaders are responsible is providing psychological support, and not communalizing or politicizing the pandemic. This is very very important, and it is the need of the hour for each and every politician, irrespective. They should only think they are Indians now. They should think only they are Indians. Swapnil Bhosle has joined now. Okay, very, very big high. And then they should not communalize and politicize, and they should provide adequate personal protective equipment, as we are talking about, and also they should also provide the safety to frontline workers. What we were talking about yesterday in regards to the attacks or the assaults on the frontline workers, or else in regards to the ASHA workers. So essential services, who are all being part of the essential services, have to be given adequate personal, personal kind of confidence, and also they have to be protected and not compromising the privacy and dignity. This is very very important. Last but not the least, this has to be what is provided, because not compromising the privacy and dignity of the individuals and families who are what is a part of the public health. Now part of the public health I'm talking about, it could be the doctors who have been infected, or the frontline workers who have been infected, the nurses, or else the ordinary individuals who are been infected and then they are part of the quarantine. They are part of the quarantine. Information has to be what you say kept very secretly. And effective treatment to reduce the COVID-19 may emerge. Please do understand here. And just reading here, you please understand. Nothing to explain here. This page, nothing to explain, but something to be understood very keenly. Because at the conclusion we are coming. Effective treatments to reduce deaths in regards to COVID-19 may emerge, and it will emerge. Definitely treatment will emerge. But till then, even afterwards, till then or even afterwards, what is important is social vaccine is needed. Why social vaccine is needed? Because we do not know that when is the next pandemic arriving, or when it will hit once again the humankind. So we should get into the practice or the mode of social vaccine, and that is very very important. And the components of the social vaccine, components of social vaccine should be in place before relaxing or lifting the lockdown. That is very important. The components of social vaccine. What are the components? We are talking about the responsibility of the leaders, IEC and SBCC. Social components or components of social vaccine is IEC and then SBCC. Information, education and communication, social behavioral change communication. So these two, and then about the political will, and also in regards to the individual citizens responsibility, all these are the components of the SB, that is social vaccine. And the conclusion what I would make is, a social vaccine can build social immunity. Look at it, it speaks a lot. Please do keep in, please do listen this last point. And I haven't seen, I'm extremely sorry, it's been almost a half an hour. Sampath Nikila, you have joined, and one at the last I would say very hi to you, extremely sorry. And this is very very important. Social vaccine can build social immunity to the devastating effect of future pandemics, by the lessons learned about addressing the root cause. So this is very very important. Now as we are going ahead with the national lockdown and extended national lockdown, what we need to understand is, we need to understand that we need to address the root cause, not just what you say overcoming this situation. We need to work on this situation at this moment now, but we need to learn to address the root causes and our responses to the current one and then the future pandemics. So what is ultimate is, a social vaccine can build social immunity. This is very important. Little beyond our topic, what if this pandemic came during, okay. Okay, fine. Probably Sriraj was asking if it would have come, then probably it would have been a disaster. I personally feel it would have been disaster. I mean, I'm talking about rationally and scientifically, or biologically. I mean, talking about the virus, the spread of virus, biologically, rationally, and then scientifically. I would say it would be a devastating effect on the on India. Devastating effect, I'm saying. Devastating effect on India. But the other side, probably which is not accepted when you're writing the answer, but this is my personal view. It could be, God has saved us. It could be God has saved us. Only thing I could say that, because looking at the health infrastructure, which is comparatively weak, if the pandemic would have hit during the Kumbh Mela, or else any kind of what is a religious congregation, then it would have been a devastating effect on the India or Indian people. Fine. Probably God has only saved us. That it has come, not at the time of any kind of congregation. Fine. Okay. And I feel that this was definitely an what do you say a class or a session which has really what do you say helped you. I personally feel I'm not trying to exaggerate myself. I'm saying it definitely. This video, this lesson, special class has helped you, has enhanced your skills in regards to a better knowledge, because I personally feel many of them, I don't say nobody, I say many of them might not have focused the pandemic 19 from social vaccine point of view, so definitely. Okay, MSD has also joined. Hi to MSG. I've just finished the class. MSD, I've just finished the class. Okay, this class would be from morning 10 to 11. MSD 10 to 11. And this is a I think it is a very good informative in regards to prelims. We have looked at many keywords and key phrases from the prelims point of view, and also from the mains point of view. Probably we have come up with at least 2 or 3 questions which could be asked in the mains also, which could be even in general essay also. Fine. And then I would wind up this session by again saying, Ina says thank you. I would also say thank you to everyone. And then Shushan says, because people came from various countries, and in India only because of the people who live outside the country, social vaccine. Live outside the country, social. Because people came from various countries, and in India only because of people who live outside the country, social. Okay, you are saying about the travel history. Persons with travel history have actually carried this virus. Definitely, that is what stage 3, that is the community transmission, is yet to take place aggressively now. Hope that will not happen aggressively. And then before I wind it up, hiding identity. Okay, yeah, okay. You are talking about that hiding identity. Yes, that is definitely there, because I was talking about in regards to the HIV. I was talking about stigma, discrimination, and then they were kept homeless. So why all that? It is a social prejudice. It is a social prejudice, and that again, when we are, it could be again a question in regards to what is a mains point of view, COVID-19 and its impact on social prejudices. COVID-19 and social prejudice. That's it. COVID-19 pandemic and social prejudices in India. Discuss, discuss. That's it. I think you definitely. I personally feel whatever knowledge I have, and I will definitely impart to you all in regards to the prelims and regards to the mains. And when I'm saying impart, take it for granted. All that will be a 10% valuable information. 10%, 100% valuable information it will be. And before I close, once again, I would say please go ahead with subscribing for the 24 months using my code SBT10. And then while you are just paying for 13 months, you would be subscribing for 24 months, and the discounted amount would be 43,200. And then please go ahead with subscription. And if there are any of your friends who are interested also, please provide them the information, or give them the information in regards to that they would be having an opportunity of just paying for 13 months, but they can subscribe for 24 months, that is 2 years, which is very required for civil services preparation. Please go ahead with that. And then it will be on the bottom. And I would say a very big hi, and then go ahead with the comments also. Thank you all. And Chota Bim was not there. I think today was there in that class today, Chota Bim, but I did not see any kind of what is a response today from Chota Bim. Okay, fine. See you tomorrow. Thank you all. Okay, what is this? Keep smiling, sir. It was a great class. Thank you very much. Thank you very much. because smile, it costs you nothing. Smile, it costs you nothing, because the smile cannot be robbed by anyone. Cannot be robbed by anyone. So it is the only thing which cannot be robbed. Fine. So thank you once again, and I would definitely take leave now. Thank you all, and then I would end the session. And here also, thank you all.